Welcome to You and Your Pets with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And this is a show in which we discuss a broad range of pet tips, care, diseases, anything related to pets. Tonight we'd like to concentrate on dental, which is something that I know very little about. And I do know that my wife, when she heard what the show was going to be, said, please ask him how you brush the teeth of a dog who does not want to have his teeth brushed. And maybe we'll ask that question a little later on. But let's start, first of all, why dental care with pets?
Well, I think it's been known in the veterinary world, veterinarians and our authorizing bodies have known for a long time that dental care in pets is a very under-recognized issue. More recently, in the last, say, 10 years, there have been a number of symposiums, a number of scientific studies being done that show that dental care in pets is very, very important. So now more and more veterinarians are looking in the mouth of a dog, looking in the mouth of a cat, and looking for certain signs of disease. So it's important because these signs are indicators of poor health. And that's why we should look for signs of disease. The indicators of disease are obviously bad breath, and a lot of people come in with their animals having bad breath, and that's one of the cardinal signs that we see, and that's why we look for dental disease, and that's how the owner finds out about it usually.
Well, you brought a number of illustrations tonight, and I'd like you to go through them. That some of them are really surprising at how serious they look.
Well, dental disease in dogs, as it is in humans, progresses, and it doesn't necessarily progress rapidly, but it does progress. But let's understand, as humans, we brush our teeth twice a day, we floss at least twice a week, and we see our dentist twice a year. As humans, as dogs, they don't necessarily get that kind of attention, although it is needed. So what I'd like to do is show or discuss a normal mouth. The normal mouth usually has pink gums that go right down to the teeth and in what we call a knife edge, or it lays flat over the tooth. There doesn't seem to be any redness, it's just a nice normal pink. The teeth are nice and white. And that's what we call a normal mouth. There's usually no halitosis, no bleeding, and usually no other issues with the mouth. The animal's able to eat on both sides of the mouth. Our second issue with increasing disease, or our first serious sign of disease, is when and this is our second picture, is where we see a really red line that starts to form at the intersection of the tooth and the gum. Mm-hmm. This is called gingivitis, and many people have heard it, and we know that it occurs, and people recognize it because when they brush their teeth and they spit out the water, it's usually red tinged. That's one of the first signs of gingivitis. Unfortunately, our dogs don't gargle and spit, neither do our cats, so we will have to recognize it as a red irritated line right along the edge of the tooth and the margin of the gum. It then progresses beyond that to get some inflammation. The red line now goes on to be inflamed, and the gum actually has a bump. It almost looks like a step between the gum and the actual tooth. And that's our third picture. That will indicate.
Let me interrupt here just for a second. When you get to that stage, is the animal suffering?
Well, I think any time you have gingivitis, there's a little bit of irritation in the gum. There's no question about that. Mm-hmm. It depends on why the animal has this irritation. Sometimes it's from chewing on bones and it heals. Sometimes it's from actual dental disease and a buildup of calculus or tartar under the gums, and that will not be resolved simply because he stops chewing. So the third stage of actual irritated, inflamed, thickened gums would be fairly irritating to the animal. You'd probably notice the animal salivating more, maybe licking its gums a little bit more, not really wanting to eat hard food, mm-hmm. and maybe starting with halitosis at this point. And that would be stage 3. Now stage 4 is a very severe stage, stage 4 would be a very severe stage where the gum actually starts receding and you can see the roots of the teeth. This would be very irritating to the animal and would probably result in a situation where there is pain. The gums have receded, the teeth are open. Either cold or hot water would cause an irritation, and that shooting pain that we get as we eat ice cream or drink cold water or hot coffee. And this also causes obvious bleeding in the food, reluctance to eat hard food, and that is actually your stage 4, and that is fairly painful. I would imagine that would be painful and has consequences, because when you're in stage 4 and the gum is receded so that you can see the root, you're mixing blood with bacteria. Blood and bacteria can get into the system, and that can cause other problems. So there are consequences to this. And then our final stage is when we actually lose bone. We have reabsorption of the bone, the teeth are loose, the gums are completely down and around the teeth. We call that a 4 millimeter or 5 millimeter pocket. In other words, the gum comes away from the tooth. It's no longer flat, no longer pink, but it's red, irritated, and it's below the neck of the tooth, and there's a pocket. And that pocket allows food and bacteria to get in there and again get into the system. So those are really the 4 or 5 stages of dental disease in a nut package. It's the same in dogs as it is in cats.
All right, let's step back on this then. It's progressive if people don't take care of it. What actually, is it just in the mouth that there's a problem, or is there a problem in the entire animal that you have to worry about when you have dental difficulties like this?
Absolutely great and insightful question. The question itself can be answered in 2 ways. Yes, there's certainly a problem in the mouth. The mouth has to be dealt with. But the bacteria getting into the blood can affect the heart, the liver, the brain, the lungs, and we can have infections in different parts of the body. One of the problems with bacteria going around the body, either from the mouth or from any other infection, is that it's going to be filtered out. And the organs that filter, as I already mentioned, including the kidneys, are those that get affected. And so dental health is a hallmark of how the overall animal would be doing in general.
Okay, so basically, this is not something that the pet owner can say, I'll take care of someday. It's something that they should take care of right away.
Well, agreed. I think the home owner or the owner of the pet has to really rely on the expertise of the veterinarian. The veterinarian, and most of our degrees say surgery, medicine, and dentistry. And all of us are key to look for the signs of dental disease. And in doing that, we can pick up what we want to pick up and identify the key significant issues in that mouth and then address those. So I think the best way to keep abreast of a dental disease is yearly, or in an older dog, every 6 months, an examination from the veterinarian.
Okay. What should the homeowner be doing on a regular basis about the animal's mouth? This comes back to the question I said I was going to ask. I have to say that my wife, who is very, very patient with our dog, just completely gives up trying to brush his teeth. She said it's not possible. This animal will not sit still for a toothbrushing. Is there a way for a homeowner, for a pet owner, to train the animal to endure a teeth brushing, or is that just fiction?
Well, no, I think it can be done. A good friend of mine, who is not only a veterinarian, he's also a board-certified surgeon as well as a board-certified veterinary dentist, and they do some really special things. His advice to me was, if you really want to save your dog's teeth and do everything you can so that you don't have to have a dental at your regular veterinarian, brush them 3 times a week. And I just laughed at him, because I don't know if anyone can brush their dog's teeth 3 times a week. However, yes, it is possible to train your dogs, and that starts when they're a puppy, not when they're 5 years old.
Okay.
So what you do is you get them used to having your fingers in their mouth, and then once they're used to that and having their jaws lifted and they aren't going to take your fingers off, you can go out and get what I call a finger caught. I don't like brushes because they're hard and they can be rough and they can injure the animal, and that will cause them to not want you to touch them. So I get a finger caught, and basically I've seen them at many drugstores. You put them over your finger. They have little bristles on the inside, and you may have seen them for people who are on the go and travel. Mm-hmm. And you put it in the dog's mouth and brush the gums. You massage the gums, and that's what's important. Now, even having said that, you might be able to reduce the incidence of dental disease, but you're still going to need to see your veterinarian. And I would guess a roundabout estimate would be once every 3 years you might need a dental. If you brush, maybe it'll be once every 4 years in a dog, and maybe once every 4 or 5 years in a cat if you brush them on a regular basis. Without that brushing, it really is up to the chemistry of the mouth and whether the animal forms plaque or has gingivitis.
You mentioned cats. Let's turn to cats. I literally cannot imagine even a kitten sitting still for someone putting a finger in its mouth. Are you saying that it really is possible to do that without them nipping you a good one?
I think it is possible. It's not a problem that I have been able to solve myself as a veterinarian and a behaviorist. It is, I'm sure it can be done with a lot of patience. In cats, it's a little bit more difficult. Cats are a little bit more independent, and they choose not to allow you to brush their teeth. Then it's sort of difficult. The other issue is that your finger, even with a caught on it, with a brush caught on it or a brush pad on it, is going to be much bigger than the cat's mouth, and so that becomes difficult to do as well. But I'm sure that cats have been taught to fetch, and cats have been taught to come on command. And so I'm sure they can be taught to sit still while you're brushing. But in general, in cats, we just see them every once in a while for a dentistry.
The easy way out is to take them out, take them in. Yeah, I have to say that in all the time that I've owned pets, the idea of doing a dental on a pet never occurred to me. I mean, and of course, I grew up in a household that had sheep, pigs, cows, that sort of thing, and
We don't do their teeth.
You don't do their teeth, and the idea that if that your dog that that you have there that you do its teeth was just something that was foreign to me. And when my wife started telling me that we had to start brushing the teeth of our dog, I just sort of looked at her and thought, well, now somebody's been feeding you a line.
Yeah. Well, it's interesting. In the last 20 years, since I graduated in 91, but even the last 40 years, things have changed quite significantly in terms of the animal health, both what we can do, what we can detect, and how we go about treating it. So yes, you're right. 15, 20 years ago, we didn't necessarily... It was under-recognized that the teeth had to be brushed, but we now know that that's part of the health scan and health maintenance for a dog or cat.
Okay, we'll continue this conversation right after we've had a break. I find it very interesting because I suspect that most pet owners who are watching this program probably don't do this and are probably a bit surprised that they need to do it. But we'll be right back. This is You and Your Pets. I'm Jim Horton.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we are talking tonight about dental care for pets, for dogs and cats. An issue about which I must say I know nothing, and so I'm getting a very good education tonight, for which I thank you. Tell me, when we start, groomers sometimes say that they can take care of the dental needs of a pet. Is that true?
Well, groomers do what we call a brushing, and that's good. They if they can, brush the dog's teeth. Normally, we don't recommend that when you're brushing the dog's teeth, you use toothpaste, our toothpaste, because they tend to like it and try and chew the brush. But groomers will use dental or a dentifrice that they can use in animals. And I think that's part of a good hygiene program. But you go to the groomers once a month or once every 6 to 8 weeks. It's not going to be the end all and be all. The actual owner has to try and take some of that responsibility. So there are a number of different dental products that you can buy on the market. I recommend the finger cot so that you can feel exactly where you are in the mouth and they don't feel the hard plastic of a brush. And then I recommend one of the toothpastes that are used by veterinarians or sold in a pet store. Any of those are good for regular brushing. Or you could even use baking soda.
Okay.
And either of those will help. Again, it's not an easy thing to do, and when you start off, it'll be a fight. But even if you can't brush the teeth, just rinsing the mouth on a regular basis will help, especially after eating.
How do you rinse the mouth of a dog that does not want to have its mouth rinsed?
Well, you can go to any one of the number of stores that sell spray containers with a little spray on them. I think, not to name names, but Target, Walmart are two that I can think of where they have in their little sections of extras, soap dishes and things like that, plastics. You can buy spray bottles and just putting simple water in a spray bottle, and after the animal's eaten, you just spray the inside of the mouth, and that will help release some of the food. A lot of the food gets tucked back in the cheek area, and that is where we see the most calculus and tartar.
Okay. So take us through what a veterinarian does when they actually do a complete dental cleaning.
Okay.
It's a fairly complex procedure, isn't it?
Well, I guess it is, in the sense that we start off the dental procedure when we start by putting a tube down the throat. Now, I think we have a clip of that. And we take the animal, we put a breathing tube down its throat, and while we have the mouth open and putting the breathing tube in the throat so that we don't cause water or any kind of chemical to go down in the throat, we put that in and we examine the teeth. We look for fractures, we look for tumors. We often see tumors in the mouth of an animal that go unrecognized simply because no one has looked in the mouth. We see dental disease, as I described previously. We see other teeth are missing. We can see enlarged tonsils. We can see many things. And so the exam really starts when we do the endotracheal intubation, is what we call it.
Now, you actually sort of knock the animal out. Is that not correct?
Correct. We give them some sort of medication, usually an injectable medication, to render them unconscious so that we can put the tube down their throat. Clearly, as you know, when you swallow the wrong way and you start coughing, if we did that when the animal was completely awake, we wouldn't be able to get the tube down its throat.
Okay.
Once we have the tube in the throat, we inflate it, and then what we do is we start cleaning the teeth. We lay the animal on its side, tie the tube in, hook it up to the anesthetic machine, and then we go ahead and start cleaning the teeth.
Okay, and do you use the same thing like a regular dentist would do, a dental pick and
Ultrasonic.
Ultrasonic and a dental, I'm trying to think of the rolling object that buffs the teeth.
Oh yeah, the polisher.
The polisher?
Yeah. Initially, an exam starts, as I say, when we open up the mouth and we look at everything. We smell for the breath to make sure that we aren't missing anything in terms of odor. Some odors come from the stomach, some come from the mouth. Once it's open, we then have a dental pack. Now, in my clinic, all these instruments are sterilized between uses. We open up a dental pack and we review the teeth. We look for the signs of disease that we reviewed before, and we use a special instrument that almost looks like a toothpick, but it's metal. It has little lines on it, and we can go around each tooth and assess whether, we talked about a pocket, whether a pocket is 1 millimeter, 2 millimeters, 3 millimeters, 4 millimeters, whether there's bone loss, whether the tooth is loose. And so that's our initial exam, whether there are any fractured teeth, whether there are any teeth that are so loose they're going to fall out. And we quite often find teeth that are so loose they will just fall out. So that's our initial exam. We use instruments then to clean under the gums, called a subgingival cleaning. And we go under the gums with hand instruments to make sure that all the tartar that has built up under the gums and is causing the irritation that we see, the redness, the swelling, the pain. We try and get all that out from under the gums on the different teeth. And so there's the molars, the premolars, and there's the incisors. There's also a canine tooth, which is that big one that hangs out. Once we've gotten all around and cleaned under the gum, inside the mouth, on the tongue side, and outside the mouth, on the cheek side, once we've done that, we then go over with an ultrasonic cleaner. An ultrasonic cleaner is like a pick, like you said, but it vibrates at very high rate of speed. It has water on it, and we're able to take all the tartar off, all the outside of the teeth. So the teeth go from a brownish gray to a very white. It's almost like doing a dental cleaning that you would use hydrogen peroxide or a strong peroxide to make it white. Once we've done that, we have left in each of those teeth little etch marks, is what we call it. And those are places where the tartar can reattach because there's a foothold. So to avoid that, we then take a polisher, which is a circular little cup-like thing, and we put what we call dentifrice in it, or an abrasive, and then powder, and we go over all the teeth, inside and outside again, to make sure that they're all polished and help prevent the need for a dentistry in the next little while.
How long does this take?
It depends. On some occasions, we find that we need an extraction, and depending on the tooth, a molar can take 45 minutes to extract, and that becomes very, very difficult. A very loose incisor might come out with simple twisting and pull. So the disease, when you get to a grade 4 disease, or the worst disease possible, grade 4 or 5 disease, the worst disease possible, it could take up to 45 minutes to an hour. If you have a grade 1 or 2 disease, we might be able to get through it, particularly if there are no pockets or fractures or extractions, in anywhere between 20 minutes to 30, 35 minutes. Now that's not including the anesthesia, but from the time we sit down and start to the time we are letting the animal come out of anesthesia could be anywhere from 25 to 35 minutes.
So that is a fairly complex exercise, and not something that anyone could do at home or even should think about doing at home.
Well, I'm sure the dog would let you know, or the cat would let you know, that it isn't
you
going to
tried
work
to
out
do
too
it.
well.
Yeah.
As you said, you can get bitten. Cleaning subgingivally, cleaning under the gums, I challenge anyone to take a toothpick and go under their gum themselves and see the pain that it elicits. So you're not going to be able to do that in a dog. A groomer can't do it, though they can brush. Anyone who says that they can do this in an adequate way, I challenge them to show me that. You really need the anesthesia both to have the animal hold still and to reduce the amount of pain.
Okay, let's go back and focus on the pet owner one more time. You mentioned using a bottle of water and spraying the mouth to at least clean it a little bit. What are some of the other things that one can do? Now, I noticed you mentioned things like diets, toys, treats, things like that. Could you go over some of that for us, please?
Certainly. More recently on the market, I've noticed several companies discussing a spray that you can spray in the dog's mouth, and it helps reduce tartar and odor. I'm sure it reduces odor because most of the disease we see in a dog is because of the biochemistry of the mouth. And having said that, too acidic or too basic of a mouth, in other words, if the pH is too far off of what we consider normal, can result in some dental diseases. So spraying the mouth might well help it from that perspective. Some of them claim to take a dog with tartar on its teeth and resolve the problems without anesthesia and without anything else. Again, I would challenge them to put that to a test that would be acceptable to veterinary dentists and veterinary scientists who look at these things. Other issues that have come up are dental diets. Some of the dental diets, I think, really help. I think some of the dental prophylaxis, the chew toys and things, can help, but none of them are going to reduce the need for a professional dentistry under anesthesia.
A chew toy, I'm assuming, would be something that is hard and abrasive enough to clean the teeth while the animal is chewing it. Is that correct?
I think a lot of them are made that way. Some of them break apart and are abrasive, and I think that would be a correct statement, that the design of the treats or the dental bones, whatever they might be, are designed to scrape the teeth. But if we consider that it's also scraping the gums, so we have irritated gums. So we don't really want irritated gums. So I think some of them can help, but none of them are going to avoid the need for a dentistry.
And I would assume that when we're dealing with, well, first of all, with a cat, I'm not sure what exactly you would use in terms of a toy. Maybe, I guess there must be something for cats.
I'm sure there is. I can't think of one off the top of my head.
But okay. But I guess when we get right down to it, the animal, if the animal doesn't really like that toy or doesn't particularly like that food, you've spent a lot of money for nothing in particular, for no result whatsoever. So that getting the animal toys and treats and food may just not do it. Is that correct?
Well, I don't think we can count on anything outside of a professional cleaning of teeth under anesthesia to do a 100% good job. You may get rid of the tartar on the outside of the tooth, but it's unlikely. I can't see how it could happen. I haven't read any scientific articles that say it does. Get rid of the tartar under the gums, which is what's causing the problems, a lot of the problems. So diets are going to help slow the progression. Dental bones are going to help slow the progression. Sprays are going to help slow the progression, but it won't stop the progression of dental disease.
What happens to an animal when its teeth begin to fall out?
Well, the consequences to an animal is that obviously as the animal gets older, teeth have more and more problems. We prefer to do dentistries when they're needed, but if you come in with an animal that's 16 years old that has never had a dentistry and now requires one, we have a much bigger issue. We have an issue with the anesthesia, with the cardiology, with the heart. And so older animals that stop eating because their teeth are sore, we know that to do a dentistry under anesthesia is a challenge, but to not do a dentistry under anesthesia is also a challenge. So in terms of not doing anything, you end up having some severe dental disease, and as I said, that leads to cardiac disease. It can lead to kidney disease, heart disease, liver disease, and so on. So it's a devastating catch-22 if you allow the animal to get too old without having proper dentals.
Okay. And with that, we're just about done and just about out of
Perfect.
time. And I want to thank you very much for
thank
taking
you.
us through that. This is a subject about which, as I said earlier, I know nothing, and you have given me an education. So thank you one more time. I'm Jim Horton. This is You and Your Pets, and thank you very much for watching.